The president obviously has access to world-class care. He's received a number of treatments already. At what exactly these medications aimed at trying to solve? And is it safe to receive them all at once?
Well, yeah, so the three most notable treatments that the president has received are Regeneron's monoclonal antibody cocktail, Gilead's remdesivir, and the steroid dexamethasone. Each one targets something different, from the virus to the way it copies itself to our own immune response.
Friday, President Trump received an infusion of Regeneron's mix of two antibodies. They work by binding to the spike protein of the SARS-CoV-2 virus. This is what the virus uses to invade our cells, and by attaching themselves, these laboratory-produced antibodies can neutralize the virus. It is important to note that although clinical studies suggest that it's safe, the Regeneron antibody cocktail is not FDA approved at this time and is not considered part of routine care. Now, over the weekend, the president also started a 5-day course of remdesivir. This drug does have an emergency use authorization granted by the FDA. Remdesivir works by blocking the ability of SARS-CoV-2 to make copies of itself once it's infected a human cell. If the virus can't copy itself, it can't go on to infect other cells in the body. Remdesivir has been shown to shorten the length of illness in hospitalized patients who receive it, but there is still some debate on how effectively it might reduce the risk of death. Now, the third medication given to the president is the steroid dexamethasone. This very common drug has potent anti-inflammatory effects and has been shown to decrease the likelihood of death in hospitalized patients that require oxygen or a ventilator. It works by calming the dangerous immune overresponse that the most severe COVID-19 patients have.
Now, the biggest potential downside to dexamethasone is that by blunting the immune system, if it's given too early, there is a possibility that it could open the door to the virus by blocking a person's ability to fight back. Now, as far as the safety of giving all of these medications at once, remdesivir and dexamethasone are already routinely used together, and there isn't really any reason to think that the Regeneron antibodies would be problematic with those other medications.
Yeah, Frank, what about this convalescent plasma? We've heard the president talking about this and its potential benefits.
Yeah, he's shown some interest in that in the past. Now, as far as we know, he hasn't received convalescent plasma. But keep in mind, the Regeneron antibody cocktail that he received on Friday is a direct infusion of two specific antibodies that are directed against the coronavirus. The benefit of convalescent plasma is that it contains antibodies, but they are a non-specific mix. The antibody cocktail that he got would actually be much more targeted already.
Yeah, so much to consider here. Okay, Frank, we appreciate it.